nice. We managed to actually take a drive to London on Saturday to the center, the Light Center, Sukio Mahikari, and just for a ceremony because it was a founder's birthday. So that was one of our first trips we've made on the road. And surprising, and I'm not surprised. I was telling someone else as well that, and someone else commented to me as well that people are actually listening. They're keeping to the guidance. Everywhere you go, people are wearing masks. And, when we started off with the pandemic in March last year, February, March, and to where we are now, there's such a huge difference with the way people are complying with the guidance of wearing masks, social distancing, and understanding, what's going on in the world and in the UK. So it was really good to see that, getting to the center, we had our temperature taken. We had to ensure that there was strict guidance, wearing a mask, washing our hands before we even entered the prayer area. So, and even in the center, there were only a few people allowed at a time. So just my family, just me and the kids. So it was really strict guidance. But like I said, it's good to see that people are adhering to the guidance. And even when we stopped at different shops and the petrol stations, everyone was wearing a mask. you know there's just not one person I've seen without a mask, even if, and the weather was really lovely on Saturday. It was absolutely warm. Yeah, it was absolutely warm. So there were a lot of people out, but it was all done very, very carefully, very cautiously, and in a really good way that you actually feel safe going out. That's what I felt quite safe.
Yeah, that's what I noticed as well. I noticed that people are. It looks as if it's just hit the realization. It's just hit all of us. So look, we've got to do something about it. And you look around. You go into town, drive through town, and I drove past the. Was it on Friday? I did.
Yeah.
It was Friday. I went to the cemetery area.
Yeah.
With the St. Tom's funeral.
Oh yes.
Area and all that. So yeah. Those heavy police presence. There were a lot of people lined up on the street, but every single person I saw was wearing a mask and then social distancing and all that. And another thing I've noticed, really, to be honest with you, is the fact that more and more people are taking the vaccine, especially in the Black, Asian, and minority ethnic community, the BAME community. A lot of people that I spoke with on the phone, and everybody says, "Oh, I've had my first jab. Oh, I'm going for my jab. On Monday." And I think it's amazing. People are becoming really serious about this issue. But to go on with this COVID thing, now health officials in England are trying to trace one of 6 patients infected with a contagious coronavirus variant. The Brazil variant. This is it's a bit scary. When I saw the news last night, and I was thinking, oh God, one person is not there. But at the same time, I must give it to Great Britain. They're doing an amazing job for them to be able to know and to realize that there's one person missing, and that person must be found. I think it's commendable. What's your take on this story?
Yes, yeah, no, it's quite, I think it was, so mixed emotions, because we've actually come to a point, the combination of rollout of vaccine together with the social distancing and the lockdown measures has resulted in the numbers in the UK coming down. So we've actually seen the numbers come right down. We've got like 144 new deaths, and obviously every life matters, and at the same time, the number of positive cases have come down to 6,000. So that's a huge milestone we've reached in the pandemic in months. And then now hearing this news obviously is now causing a bit of concern, and rightly so, because it's a new variant. It's a Brazilian variant, the P1, which they are saying that these travelers have actually traveled. I think they traveled from Japan, if I'm correct. So there were some that had traveled. Yeah, so there were Scottish residents which had flown to southeast Scotland from Brazil via Paris and London. And they say that, but this variant actually was first detected in travelers to Japan from Manaus in northern Brazil in January.
Manaus in Brazil,
Yes. So, and they're saying that it could be more contagious. So now, yes, great. You know, you've commended the NHS and the track and trace team, trace and test team, because it's track and trace. It's right. I was right. It was a tongue twister, so I said it and then I thought, okay, let me just change it. So track and trace team, you know, thanks, hats off to them that they're able to actually identify and, you know, find out and actually trace. Now they're trying to trace the one person that's missing. So this is obviously causing some concern because they're saying it's more contagious and they need to act quickly. So this is what we know of the variant. So that's obviously concerning news at the moment. They said 2 people in the same household had tested positive for this, but then the tests are still ongoing. They're also tracking passengers who on the same flight from Sao Paulo to Heathrow via Zurich. So they still, Public Health England obviously is still trying to trace it. Yeah, I mean, what I make of it obviously is just a mixed emotions because we started to see the numbers go down. Things are looking really positive in the UK. But at the same time, we're just a bit concerned now about this variant, which potentially could spread. But I'm sure whoever's listening, and I'm sure the person probably by now might know who they are, and hopefully that it should be out very soon.
What gives me some assurance or a lot of assurance is the fact that no matter what you do, 1 or 2 people are going to, you know, go through the cracks. You know, they're going to come through. But what gives me assurance really is the fact the efficiency of health workers and the NHS and the track and trace people, for them to actually be able to say, no, there's one person missing here. And that's very assuring. That shows that they are on top of their game and they are doing everything they can to help curb. And I am so positive there, Dr. Seshni. I have been very positive from the beginning, but this time around I'm extra positive that, you know, the way things are going down, they'll keep going down. Once in a while, we'll have a little surge here and there, but I believe strongly in my heart, and I'm very optimistic that it's going to get better.
Yes, I'm optimistic as well, like you. I think this is one of the first times in the pandemic that I'm feeling a lot more safe. As I said, when we went to the center, the Light Center this weekend for Sukunishisama's birthday, the founder of Secure Maikari, it was really safe. I felt safe to go. There was no concern. Like it wasn't, I'm usually, you know, how I would have hesitated to even leave the house in the beginning of the pandemic. But now I'm feeling quite safe actually. And it was a good experience. So I think, yes, I think it felt like as if, you know, like you're saying that you're feeling quite optimistic, things are going in the right direction. It feels as if the fear, you know, there was a lot of fear, there was a lot of chronophobia, there was a lot of anxiety. And I think all of that, now that the numbers are going down, the weather's changed, and we've got the rollout of the vaccine, and also, you know, the people are adhering to the guidance. I think people are feeling a lot less anxious, and it's so important. You know, as a doctor and psychiatrist, part of the mental health we've been talking. This is how we started the show. It feels to me we've actually come to a point where we've just taken a shift and things are really looking more optimistic. More, like you said, it's more positive. There's less anxiety, there's less fear. And I think we all know what to do now, you know. We're more equipped.
We're not facing it and not fearing it.
Exactly. I think we're facing it and not fearing it. And I think that I think the lockdown has helped a lot. I must say, as much as it would have affected the economy, I think the lockdown has definitely helped. I know that, you know, obviously schools are going to go back into effect on the 8th of March. There's a lot of talk about that. Obviously, they're going to be doing rapid testing for families if need be. So they will be doing rapid testing for people that are going back to school. But yes, everything's looking a lot more positive.
Yeah. And then the other story that on the news that for me is really good is the fact that the UK's COVID vaccination will receive an extra £1.65 billion in the budget. When the budget is read, so to help it reach its target of offering a first dose to every adult by the 31st of July. This is good. This is good, I think. I believe.
Yeah. So yes, I mean that
tells you how serious the United Kingdom is about the vaccination, and how serious this country is about, bringing down the numbers of deaths and infection and all that.
Yes, I think we've it's sort of been a good learning lesson. I think there was a lot of criticism very early on with the way the pandemic was managed, and I think Britain definitely has shown that it's trying to recover its reputation and also do the right thing. And definitely the evidence is there to suggest that we are seeing less numbers now, so which is very reassuring, because as the numbers go down, less people are dying, we're getting less people infected, there's a lesser chance of spread, lesser chance of vulnerable people dying, and also there's a decrease in the load on our frontline workers. So all in all, it's having a very positive effect. So it's actually moving in the right direction, which is very reassuring. And yes, it's good news. It's good to be talking on radio today. And I was thinking over the weekend, it felt to me like we're coming very close to the day when we're going to be saying zero number of deaths and zero number of cases.
We're getting there.
Yeah. So it does feel like it. So yeah, fingers crossed it's all working well. But yeah, so the 1.65 billion that's going to be obviously the budget that's now been drawn into the vaccination. I think that's also it shows the dedication for the vaccination in the UK. And I think UK is also trying to help other countries that are less fortunate as well, which is good news.
Yeah, that's great. Now the other thing is, I just thought, let me just bring this in. It's I don't know how important it is, but it's about some of the side effects of the vaccine. We know there are certain side effects here and there, and I spoke to my friend last night, and he had just had his jab. He had his jab on Friday, the first dose on Friday.
Yeah.
And so I asked him, what? Did you get any side effects? I was a bit curious, and I was asking him, and he said, no, it actually went really well. The only thing was that he was itchy all over.
Okay.
I'd never heard anything like that before. So I said to him, so what did you do? He said, nothing. It's not like very serious. It was just like itch here and there. And so he said to me, and I don't know how, because I don't have any proof, but he said to me that he thinks it's just one of the side effects of the vaccination. And he did say that as of yesterday, the itching had gone down.
Yeah.
It wasn't like when it started on Saturday morning.
Yeah.
So is itching part of the, because I never heard about it before, but I just want to know.
Yes, so you can get itching. So 1 in 5 people can get side effects with the vaccine. And we've had a range of people getting anything from mild to moderate symptoms and some severe symptoms of anaphylactic reaction. But mostly people have reported initial just pain on the side of where they've been administered the vaccine. So pain in that arm for a few days, or slight swelling on the site of the injection. Some people have reported fever. So I've heard a few people reporting fever, muscle aches and pains. Itching can be one of them. And headache. So these are the main symptoms that you would get, but 1 in 5 would experience, not everyone. Itching is not a very common side effect, but again, it will just show that it's a body reacting to obviously something that's been injected. Then the other symptoms, obviously, the more severe effect of the vaccine, which has occurred, is the anaphylactic reaction. And therefore, people that have previous food or medicine allergies are advised not to take the vaccine. Anyone taking alcohol needs to be cautious when they get the vaccine as well. You shouldn't mix the alcohol and also having vaccination. And obviously, any other allergies that people have, they should just report that. So obviously, when you go for the vaccination, they will go through a series of questions, and they will ask you these questions about allergies and any anaphylaxis reactions. And those people are obviously advised not to take the vaccine. But yes, the side effects have been variable. It hasn't been experienced by everyone. I mean, some people have just said they've not experienced anything, whereas you would get some people that would have reported.
Most people I've spoken to, they didn't get nothing at all, except a few who said, oh, they, like you explained earlier on, they had pain on the arm. That's it.
Yeah.
End of story. Nothing. No. Except this friend of mine I spoke to last night, and then he said, he said he's fine. Everything is great. He's not feeling anything apart from the itching. And honestly, that was the first time that I heard about the itching side, the side effect of itching. So I said to myself this morning, when you join, I'm going to ask you, because I never read on that. I never knew that itching was part of it.
Yeah.
So yeah.
Yes. So yes, that's interesting that he's had itching, but I'm sure it's just a mild symptom that obviously will go away. And if there's any concerns, I think people can just consult their GPs or health practitioners if they're experiencing any prolonged symptoms.
Well, thankfully, he did say that. I said yesterday when I was speaking to him, he said it's I mean, once in a while he'll just scratch here and there.
Yeah.
But it wasn't as bad as he did say that on Saturday morning. Yes, it scared him a bit. He was thinking, oh my God, why am I itching so much? But it's clear. It's going down now.
Yeah.
Since yesterday. Right. Okay. Should we do something local? Let's come to our local community.
Okay. Yes.
Bedfordshire, Milton Keynes, Buckinghamshire. What's going on here with infection and of course vaccination?
Yeah. So in Bedford, the Bedford Today news reported that there's been a decrease, a fall in the COVID cases in 24 hours. So yeah, so there definitely is a decrease in the number of cases in Bedford. So they're saying that so as of the 26th of February, Bedford recorded 28 new cases of coronavirus, with 12,981 having the virus in Bedford. And three deaths were in central Bedfordshire, with 1 death in Luton and 1 in Bedford. So there definitely seems to be a decrease. Buckinghamshire has a record of 30,005 cases, with Hertfordshire 73,891 and Milton Keynes 19,051. And they say that nationally, so there definitely seems to be a decrease in the number of cases from the news that I've read. And obviously the vaccine rollout is still in effect. I'm just going to go back again to Buckinghamshire to find out a bit more. But there seems to be a fall in the number of cases, which is not a surprise because, they've just said that Buckingham started as well with surge testing for South Africa variant, which was found. So there was a case of the South African variant, which was detected in Buckinghamshire. So people that are living in the HP10 Woburn Green have been asked to take the test, even if they were not showing any symptoms. So the case was not tracked to international travel. So it sounds like the person was obviously contracted it in the UK and is self-isolating. So home tests were delivered to Woburn Green and Flackwell Heath. And so that was obviously starting to go into effect. Yeah.
Going to the talking. Let's go back to the side effects again.
Yeah.
And just to read a comment that's on Facebook from Sam Giorgio.
Okay.
He's saying he just wrote that I had acute fever that lasted 2 days, but I'm fine since then. Okay, so yeah, that's another.
Oh, we're glad to hear, Sam, that everything's going well.
Thanks, Sam, for sharing your experience with us, and this is amazing. So yeah, so different strokes for different side effects and all that.
Yes, I think that's good to hear that Sam's recovered from the fever. Most of the people that I've spoken to, it has been fever. So they've either had a headache or fever, which has lasted for a day or two, and then some muscle aches and pains. Some of them obviously have had, it's continued for longer, but most people, it's just been self-limiting. So it's just, as we've said, 1 in 5 people will experience side effects, but it's not to say that everyone will experience these effects. So there has been people who have reported no side effects. So it's very
important. It's better to have acute fever for 2 days,
yeah,
than to be hospitalized with COVID and be to be intubated and all that. I don't think it can't be a good feeling at all. Even if you survive it.
Yeah.
I don't want to be there. I don't think anybody wants to be there. So it's better to have acute fever for 2 days, or have. I don't mind itching for 4 days. Yeah, it's better that than being intensive care. I don't want to go there. No way.
I know.
Yeah.
So I've got the numbers up, if that's what.
Yes, we should do that. Yeah.
I think that's what you were going to say next. So yeah, Waldo meter. I've just refreshed the page. So it's Waldo meter as of today. It's the 1st of March.
It is the 1st of March.
Yeah. So 1st of March. I cannot believe. It's the March already. It's really just flown by. That is amazing. So 1st of March 2021, Waldo meter figures for coronavirus. We have 114,694,360 positive cases globally. So the number of deaths are 2,543,402. Total number recovered are 90,254,118. The top 5 countries remain the same. We have USA number 1 with 29,255,344 positive cases, with 525,776 deaths. India number 2 with 11,112,241 positive cases, with 157,195 deaths. Brazil number 3 with 10,551,259 positive cases, with 255,018. And as you can see, why the Brazilian variant is a concern. They're number 3 in the world, so it is definitely a concern.
And the death rate is so high. I think it's number 2 in the world, isn't it?
Yes, it's higher than India. Yeah. And they're very close to India, to be honest. So Russia number 4 with 4,246,079 positive cases, with 86,122 deaths. UK with 4,176,554 positive cases, with 122,849 deaths. And we've got South Africa number 16 with 1,513,393 positive cases, with 49,993. And South Africa, I think President Cyril Ramaphosa addressed the nation yesterday. So I think they've gone again from level 3 to level 1 alert. And the vaccine is being rolled out as well.
Okay.
With similar side effects, as I've heard. So I'm just going to Ghana. Sorry, what were you going to say?
Before you go to Ghana, I was just going to say I'm particularly interested in Nigeria.
Okay.
Because I read a few stories yesterday about Nigeria, and let's see what.
So Nigeria is number 73 with number 73 in the world.
Number 73, yeah, okay.
With 155,657 positive cases, with 1,907. So what was the story about?
Well, there was this thing about a couple of stories I read about infection rate going higher in Nigeria, but it doesn't really look that bad here.
No.
And of course, obviously, every life matters. But for a country like as huge as Nigeria, with a very huge population, the most populous country in Africa, for them to have 1,907 deaths, it's quite commendable. It's not as bad as I thought it was, as I read it was.
Yeah.
Yeah.
I think these countries, they're probably seeing the second or third wave, but even though they've still done well, they've actually performed really well in the first wave, which is reassuring. So Ghana, number 88 in the world, with 84,023 deaths. 84,023 positive cases, my mistake, with 607 deaths. Ghana's nowhere near that number of deaths. So Ghana is very, very low down. They've done really, really well.
Well, they've rolled out the vaccine in Ghana as well. So,
yes.
Yeah, it's,
And UK, the last 24 hours.
Yeah.
Sorry, if that's okay. I'll just.
It's all right. Just go on.
I did mention it earlier, but so it was 6,035 positive cases in the last 24 hours and 144 new deaths.
Whoa, we're going down now. Yeah,
yes. And just an indication, over the weekend, it was 7,434 new cases with 290 new deaths. And the day before that, 8,523 with 345 new deaths. And then before that was 9,985 with 323 deaths. So we definitely, I think it's the lowest. Today, it's the recorded lowest.
Yeah. I'm just praying that tomorrow we'll have another recorded, record.
Yeah.
That would be good.
I think it's going down from now. It probably will be going down. It'll just be interesting to see when schools reopen as to what will be happening. You wanted to say something. Sorry, Apoko.
No. When we're doing the Ghana thing, I wanted to say that we're hearing reports from Ghana, from friends and family. They're saying that people are not really taking it seriously, and this and that. People are just relaxed and all that. But looking at the numbers, it's not that bad. Yeah.
Yes.
But then again, they don't have to be complacent and say, oh yeah, because the numbers are not too, that we're going to relax. I think they should continue doing it.
Yeah.
And also, they're thinking, oh, now we got the vaccine, so yeah, we can do our thing.
Yeah.
It doesn't work that way. It doesn't work like that.
Yeah, exactly. I think you're right. They shouldn't be complacent. They should still be adhering to the guidance. I must say hats off to people in England, because this weekend I felt so safe to go to the Light Center, Secure Mahikari Center, and it was amazing. I did not feel fear. I did not feel anxious. I felt really safe, and I felt safe to go out with the family. It's not to say that we're going to be going out from now on. That's not the case, but it was just so different from where we were months ago, where we couldn't leave our home and we couldn't even think about going out as a family, or even going for walks. We've started going for more walks because we feel a lot safer. And even if we are going, we're wearing masks and we're socially distancing, and everyone is doing the same. So I think we've really, I mean, hats off to people in England. They're doing a fantastic job, and it shows. The numbers are going down. The healthcare workers have done brilliantly. The frontline workers, the taxi drivers, lorry drivers, the people supplying us with our delivery drivers, with everything on a day-to-day basis. Everyone's done so well that we actually all feel so safe. And you know, the vaccines being rolled out, that's been absolutely amazing, with the GPs and the different centers, and also with people just listening and just being more strict and following the guidance, you know, thanks to everyone that's doing their bit, because every little bit helps. And it definitely is showing that we are spreading the love and not the virus. And we're seeing the evidence, the numbers are going down. So just keep up the amazing, brilliant work, everyone that's working, the frontline workers and everyone else, and essential and non-essential.
Right, thank you very much, Dr. Seshmi, and I'll see you tomorrow. Fingers crossed. And tomorrow, when you come, I want us to check out the story of the Johnson and Johnson vaccine that's been proposed.
Oh yes, I saw that actually. I did see that.
But we can't talk about that now, unfortunately, because our time's up. So if we do a bit of research, and then when we come tomorrow, we will talk about it. Thank you very much for coming.
Thank you, Poku. Have a fantastic day.
And you have a fantastic day.
Love to everyone.
Thank you. And yours. Bye-bye.
Thank you, Poku. Thank you, everyone, for joining. That was a Hospital Radio Bedford with Opoku Apari. Stay safe. Namaste, guys, and have a lovely day.